Good afternoon. I'm Donna McKay, the Executive Director of Physicians for Human Rights, PHR. This month marks the one-year anniversary of the launch of our webinar series on the health and human rights implications of the COVID-19 pandemic. And since then, these conversations have provided a trusted space for healthcare workers, scientists, researchers, advocates, and voices from the front lines to examine and speak to the various impacts of the pandemic on public health systems, on healthcare workers, at-risk populations in the United States and across the globe. So I want to thank you for joining us today for what I know is going to be a very informative and a very timely conversation. Our goal is always to bring science-based analysis and approaches to guide response to this public health crisis, especially as we deal with today's topic, the spread of online mis and disinformation during the pandemic and how to combat it. Whether it was through an online social media post, message boards, or even through elected officials, past and present, we've all heard multitudes of conspiracy theories and falsehoods on how the COVID-19 virus originated, how it's spread, how it's contracted, and even how it's treated. And look, while most of us know that ingesting bleach is not an answer to COVID-19 home remedy, the circulation of misinformation and disinformation is extremely dangerous and potentially life-threatening to individuals all over the world. And the spread of false information plays an especially dangerous role in exacerbating vaccine hesitancy, promoting distrust of healthcare professionals and governments, and ultimately prolonging this public health crisis by contradicting science and fact with fiction. So we have an esteemed panel with us today to share their insights and experiences combating mis and disinformation. And I'm really honored today to welcome today's moderator, Mike Posner, who brought this wonderful panel together. Mike is the founder and director of the NYU Stern Center for Business and Human Rights, the Jerome Kohlberg Professor of Ethics and Finance and Professor of Business and Society at the NYU Stern School of Business. PHR is also very lucky that he serves as a member of our advisory council. He has been a longtime friend of PHR. Mike has built a momentous career as a leading voice in advancing a rights-based approach to national security, combating discrimination, and advocating for the protection of refugees. He is the founding executive director and former president of Human Rights First, a partner organization of Physicians for Human Rights, where he was for over 3 decades. And prior to joining NYU Stern, he served in the Obama administration from 2009 to 2013 as the Assistant Secretary of State for the Bureau of Democracy, Human Rights of Labor. He was an extraordinary champion there for human rights all over the world. So Mike, I want to thank you so much for joining us today and for leading and bringing us this panel, and I turn it over to you.
Great, Donna, thank you. And back at you, I'm a huge fan of Physicians for Human Rights and have been really almost since the organization was founded. And in those early days, I remember a lot of the focus was on Latin America, on the Middle East, on Africa. And now here we are trying to make human rights, the right to health, a human right in the United States. And what you're doing, and on these issues in particular, is become amplified by what we've seen during the pandemic, during COVID, where inequality in our society is so much more obvious. And the health consequences are so profound. So this is an important topic. We have 3 great panelists that I want to introduce at the outset, and then let's get going. We're joined first by my terrific colleague, Paul Barrett, who's the Deputy Director at the Center. And Paul comes to us from a long background in journalism with the Wall Street Journal, with Bloomberg, Business Week. He's the author of 4 books, and he's done 7 reports for us on issues related to disinformation and harmful content. So he brings that expertise to this panel. Dr. Daniel Fugui is an emergency medicine doctor at George Washington. He is a war veteran. He worked in the Obama administration, and he's going to bring an essential piece to this discussion, which is from the front lines of the medical world. How are these issues of disinformation playing out? And what can doctors and others be doing basically to combat the disinformation that is now swirling around our internet? And then finally, last but not least, Theresa Kumar, who's the founding president of Voto Latino, She's an activist, she's an entrepreneur, she's an Emmy-nominated contributor for her work countering disinformation in the Latinx community, both in terms of voting, but also in terms of the health emergency. So welcome to our panelists. And Paul, I want to start with you. You know, when I was in the State Department, we had a kind of rosy view of the internet. I ran an internet freedom campaign with Secretary Clinton, and there was a sense of unlimited potential for the internet. You know, it expanded space for all kinds of exchange of ideas, information, political views. And in the last few years, we've begun to realize some of the challenges and some of the negatives. It would be great if you would sort of open us up by saying something about where we've come in the last few years, where we are, and how this issue of disinformation, misinformation is now very much part of our lives.
Right, sure. Thanks, Mike. And very honored to be here with the other participants. You know, you're describing what I think of as the utopian era of the internet or social media, when the medium seemed like a brilliant new tool for free expression and commerce, education, political communication, and it was almost entirely free of regulation, which is unusual for an industry that became as large and influential as it is. That was by design. Congress in 1996 passed legislation that set up basically a self-regulatory regime for online businesses, including what we would eventually call social media, protected those entities from liability, meaning that they couldn't be sued for harmful material that they allowed on their site or for the material that they took down. Content moderation, the crucial function of deciding what to leave on a site and what to take down, was largely an afterthought for companies like Facebook, YouTube, and Twitter. And all that didn't really begin to change very significantly until 2016 and the presidential election, in which a collection of Russian operatives secretly presenting themselves as Americans participated by spreading misinformation and disinformation online under assumed identities and pushing for the election of former President Trump and trying to undermine the candidacy of Secretary Clinton. Beginning in 2016 and taking root basically in subsequent years, there has been a process of the major social media platforms beginning to pay more attention to the problem generally of harmful content and particularly mis and disinformation. But I would think it's fair to say that not till this year, till 2020, and the dual onset of the pandemic and an extraordinarily bitter election, that we saw two things. One, just how bad the mis and disinformation problem had become, and we saw the companies, the social media platforms begin to acknowledge and take some responsibility for removing misleading information, pointing people toward more authoritative information and so forth. But they haven't, in my view, in our view, done nearly enough. There still is a tremendous problem that we have with harmful content online. And there is the beginning of a discussion now under the Biden administration of what government needs to do, perhaps in an affirmative sense, to put guardrails in place so that there would be some hope of limiting the supply, so to speak, of all of this very detrimental material. And I can go back and talk about some of the specifics about what regulations might work and what the companies have been doing. But I would conclude by saying overall, we still have a very considerable problem with harmful material that's available to users all around the world.
Great, thanks, Paul. And Dr. Fabui, if I can call you Dan, Dr. Dan, take us inside the emergency room where you spent the last year dealing with the daily onslaught of these COVID cases. How are you doing? Is there a break in the action? Do you begin to feel some sense of hope in what you're doing? And if I can add to that, when as you're treating patients, do you have a sense that there's a greater recognition of the risks associated with walking around without a mask or going to parties and the like? Do you have a sense that there's a greater recognition among your patients of what's really at stake here now after a year?
Yeah, thanks for asking that question. It's been a challenge, no doubt. I think when I see patients, they understand the risk. It's easy for them to enter the emergency department and follow the instructions of our greeters, where they tell them to, wear a mask even when the doctor comes in or the nurse comes in, and while you're in the waiting area and things like that. So I think there is a sense of understanding and urgency there. I think the issue is what the beliefs are when they do leave the hospital setting, or in this case, any organization or industry or store or corporation they walk into, if the culture is lax. So I'm saying that when they come to the hospital, there's clear signs. You need to wear a mask. You need to social distance. So the messaging is clear. And when we engage those patients, they understand that. Even when I walk into the room, as I'm going to greet them with my mask and my N95 on, they also wear their mask. And some may have it down by their face, but they actually, as soon as the doctor or nurse walks in, immediately they know what to do. So I think it's clear, and I think they have that sense of urgency and understanding. But I think the other factors, be it political or their beliefs or other settings or modeling that may be occurring, be it parents or be it the patients themselves or family members, also play a role in that, in their decision to mask or not to mask.
So I want to follow up on that. When they're in the hospital, the rules are clear. They get out of the hospital, they go into a community where there's a lot of disinformation, confusion. I know that you've been trying to use and think about the effect of the Clubhouse app. Give us a sense of what are you seeing going on online? What are the misconceptions that you see spewing out, and what are you trying to do to combat that?
Yeah, so this is kind of an interesting concept. I mean, it literally reminds me of my time in the military. There is a tactic in terms of how you fight misinformation and disinformation. I think the tactic is a little bit different, but the point is you have to go where people are and you have to meet them where they are. So it's not like everybody's in a certain location or they believe this because of one particular thing. There's so many things to that dynamic. So in that case, we have to actually really address those things. And how do we address that? So for example, in the Clubhouse, and not to say that Clubhouse is the only outlet, but just as one of the levers and where to go meet people, people come in with different questions. They think, is there 5G in the vaccine? Where's the evidence that shows the mask protects against it? Is there really a virus? It's going to alter my DNA. How long have we studied this? This is just a new virus and this is a new vaccine. So how do we know these things? These are all the questions that people ask, but it's deeply rooted in their belief system, either what they've seen on TV or through their family or relatives, or just discussions at the regular shop or store. And our job as the provider to help educate the end user is to understand what is their fear. I always ask them the question, what is your why? Why do you want to take the vaccine? Why do you not want to take the vaccine? And then that way I start to understand where they're coming from, what it is. And what I've learned is that the touch point is it has to be something personal and it has to relate to something personal for them, i.e. my why, and I give them my why. My why is for my parents. My why is for my children. My why is for the emergency department so I don't have the surge of patients that I can't take care of, other patients who come in with pneumonia or a fracture or a heart problem, all because we're worried about COVID. So those are the things and the messages along that, while having culturally competent communications, meaning you're understanding the cultures and let them also run it by their own particular messengers, because it's all about the messenger. Who do they trust? Is it their pastor? Is it their barbershop owner, their hairdresser salon area? Is it their church or their mosque? Wherever their source is, you need to find their leaders and their media outlets or who their trusted messenger is and then give them the information, make sure they have accurate scientific information, and then they hopefully start to disseminate that. It's not a force, but it's also voluntary, but also educating. So letting them come to that realization by you taking the time and showing your compassion and educating that message. Thank you.
I just want to follow up with one more question on what you just said. So one of the keys you say, and it makes total sense, is to find trusted messengers in their lives, the minister, the family member, whatever. Do you see that happening more? Do you see online? We're talking here about the online experience. Are you or others able to mobilize more trusted messengers to flood the zone? We see so much disinformation that goes viral. Is it possible to overcome that by having enough trusted messengers out there providing an alternative point of view?
It's a challenge. I'll be perfectly candid. It is very challenging. I think for every accurate information, there may be 5 to 10 times more disinformation. And it only takes a little sprinkle of the truth, and then you fabric it together with all misinformation. And because they do a search, a Google search, simple Google search on one word that sounds scientific and that's accurate, oh, well, all the rest of the story must be true, is what the thought process is. So that's how the misinformation gets to be propagated easily, and the sharing. So what we've tried to do is try to figure out which ways and where you can. So on the social media outlets, on the apps, and then what governs that, whose voice are they listening to? It's very challenging. How we can, there are multiple ways, but yes, I would say definitely it's overwhelming. The misinformation, disinformation definitely outnumbers the trusted information and sources.
All right. Maria Theresa, I want to bring you into the conversation. Your organization, Voto Latino, was at really the forefront of combating disinformation in this most recent election, especially in the Latinx community. And you're also now and have been focusing on addressing this subject today, which is disinformation in the health sphere. Mm-hmm. Great to have you sort of weigh in a bit on what you've been doing and what's working and what are the challenges you face.
Well, thank you so much for having this conversation. I think that a lot of the items that Paul and Daniel both brought up are things that brought Voto Latino to the space. I will share with you that in 2016, we saw disinformation already popping up targeting the Latino community. And by 2019, they were targeting people in my staff that had no business being targeted because they were not democratic socialists, so to speak. So one of the things that Voto Latino did was we went from 10 celebrity folks to identifying 267 influencers that could help identify the disinformation and then basically bring it in, give them the right information, and send it back out. And we ended up mobilizing and targeting 3.7 million low propensity voters. We ended up registering over 615 million voters. To give you an idea what was happening in Florida, Voto Latino saw what was happening in Florida of the disinformation back in the middle of 2018. This wasn't new. What was new, though, is that we found that Florida was kind of like the petri dish of disinformation, whatever stuck. Towards the middle of September, we started going to the Rio Grande Valley. And then it went up to the southern border of New Mexico and Arizona. I am of the deep belief that had the election happened 2 weeks out after, Arizona would have been a lot closer than it already was. To give you an idea, though, why we're now really exploring all of this anti-disinformation, combating it in the Latino community, I think it's fundamentally to really ask the question, why? Why are people using health to make sure that people do not get vaccinated? And I will give you an example that happened to my family. My mother runs a small elder care facility in Northern California. Kaiser was coming on site to inoculate her team, to inoculate her patients, and to inoculate her. It took me 7 weeks to try to figure out why she told me that everyone was going to get inoculated except her. It turned out, as Daniel pointed out, that a member of her friends from the gym had forwarded her a video in Spanish of a woman who presented white, spoke very articulate Spanish, who claimed to be a pharmacist, saying not to take the vaccine because it was a new technology never introduced into humans before. And that was one of several videos that my mother shared with me. When you start making a realization that it was also with undertones of you can't trust the government is not on your side, and you park that piece there, and you realize that it is a tool for us to stop trusting government, to start trusting our institutions, and fundamentally, at the least impactful, create a voter suppression tool. At the most impactful, Ronan Farrow about 3 weeks ago did a profile of a woman who was a yoga instructor. She was a mother of 8. She did not espouse Donald Trump's policies and did not vote for him the first time. Under COVID, she went down the COVID misinformation, disinformation rabbit hole, and now she is a fugitive for being part of the insurrection on January 6th. So the disinformation surrounding healthcare it's an on-ramp of two things, either voter suppression or radicalization at the most extreme. And that is why Voto Latino is participating, because we recognize that the Latino community is at the forefront, sadly, of the tragedy that is COVID. We have over we did a study at Voto Latino where 7 out of 10 of the folks that we surveyed had either had COVID themselves or knew someone who had it. Of that population, 3 out of 10 of them knew someone that had died of COVID. Yet when we asked, would you take the COVID vaccine? 47% of them were reticent, and a whole 25% of them said no way. This is a public health problem. It's a democratic problem, but it also is a problem that has to be addressed, not just in conversations like this, but also bringing in the social media groups. Paul had addressed this problem, how the social media has a tracking device. Facebook has a tracking device so that at some level, people can say whether it's true or not, what they're reading. That is non-existent in the Spanish language, let alone in immigrant communities. If you were to ask me, one of my concerns is the other thing that we saw is that they were using a lot of social media in Spanish and other languages, figuring out what stuck. And then they would uplift it and spread it out into English language. The example that we saw was around the voting systems. If you recall, there was a lot of concern whether the voting boxes were real, the voting machines were real. We flagged it for the administration in the middle of November because we saw it happening in Spanish language. Almost to the nose, 10 days later, that language stuck so well that we saw it in a firestorm in English traditional media. And so if you were to ask me, why is this of import? One is to keep our communities as safe as possible, but also recognizing the nefarious activity that is very real, that is trying to undermine our institutions, our democracy, and it's done by not just in-house actors, but also foreign actors.
So I want to follow up on that. There's a question about what's a best practice, what's working. I know you've said, I read an interview where you say you're beginning to work with people in the Biden administration to figure out what's a way to combat some of this, what you're describing, a very deliberate campaign of disinformation. What are the things that you're doing or you see others doing that are really working?
So we partnered right now with Media Matters, and they are a social listening media platform that identifies things that are not, when people are not telling the truth at a very basic level. And so what we're starting to do with them is identify where are those epicenters of disinformation. Florida is an epicenter. There are other epicenters. What is happening, what is sticking, and then better analyzing it with the full result, quite frankly, is of inoculation. What we do know is that if you're able to look around that bend before something hits, when someone reads it, when it hits them, they're like, you're right, that's false. I know that's false. So we've inoculated them. One of the other things that we do, and we'll be doing with the Biden administration, is just separate conversations like this to our audience. We're working right now with one of the social media platforms to create a series of information around COVID so that it becomes, again, elevated. They have the biggest marketplace, so to speak, and we need partners to make sure that we're bringing it out. But finally, the other thing that we're doing is we'll be working with local groups and providing them modest funding so that they can bring some capital and some bandwidth so that when they identify disinformation, they send it back to us. It becomes a feedback loop, and then we spit out the right information so that they're inoculated. All that information, we would love for Physicians for Human Rights to use it. It's going to be white labeled so that every single group feels like they own it, but it's with the right information that we have.
Maria Theresa, one last question along this line. You mentioned the statistics. How many people in the Latinx community have either know someone who's gotten COVID or know someone who's died? And I think your number was 47% of the community is still reluctant about taking a vaccine. Is that number changing? Do you feel you're making a dent in that? That's a huge number.
It's a huge number. And part of it is that they are still not seeing the distribution of the vaccine in their communities. And so there is the folks that want to can't even get it. But the reticent part is what gives me hopeful is that of that 47%, you had a good 23% that said, maybe I'll take it. We can work with them. The other part is going to be a lot hard. It took me 7 weeks to convince my mother to take the vaccine, and she's in the healthcare profession, right? And she was embarrassed to tell me why. So I think deep down she knew that something was off, but she didn't know how to explain it to me. So I think that what the doctor mentioned before is critical to the work. It's critical the way we do our work. All of this information is peer-to-peer. And there is a place for the platforms, because the platforms can say, well, this is a closed WhatsApp group. It's a closed WhatsApp group with a few thousand folks or even 200 folks, but you know that they've shared this message has been forwarded 7,000 times. It's not that closed anymore, right? So there is a place where you can actually make sure that there's more accountability on the platforms such as Facebook and so forth. And I do believe that there is a very different strategy for non-native English speakers. This, what I described to you, happening in the Latino community. I've seen it in the Caribbean community. I've seen it in the South Asian community. It is a strategy to make our institutions and our country vulnerable.
So Dan, I want to come back to you. In addition to all the challenges we're describing, we have some government leaders, especially at state and local level, who are not exactly helping the cause here. Let's think about Texas in the last week. I saw a statistic that less than 8% of the people in Texas have had 2 vaccines, have had 2 shots, are fully vaccinated. And yet the governor of Texas has announced a free-for-all. Let's lift all the restrictions. What do you see that as a health professional who's dealing with this every day, the consequences? How do you and other doctors respond? What are the ways to kind of create an environment where those sorts of decisions are challenged, or at least people individually are encouraged not to take the advice of a government leader that's telling them everything is okay? We're on the cusp of a moment here where we really could have progress. And yet I'm very nervous, I'm sure you are, about what's going to happen even in the coming weeks.
Oh man, this is definitely a nice what I would call an alley-oop. I'm going to slam dunk this one. And the reason why, it's just because I was so livid about this issue, literally, when I saw that on the wires. Literally on my Twitter page, it's more direct and expletive type responses. And that's me stepping outside the box and even wearing a military hat on that. I was really disappointed because we keep learning the lesson over and over again. Actually, we don't learn it. We re-experience it. We had multiple times to learn this thing, from H1N1, SARS, and even just all the other countries, the countries who did it well, who are now enjoying the reaps of the hard work that they put in. And yet we're on the precipice of getting to defeat the virus, and you want to now take the most important measure that we actually have scientific data that actually says that it works. It is undermining the public health response. It makes all the sacrifices healthcare professionals and others who have been on the front lines in all factions of life. It basically spits in their face and tells them, now we can take the seatbelt off, we can just drive recklessly as much as we want. It is irresponsible. I call it garbage, actually, in a couple of the media outlets in which I spoke, and to be published actually tomorrow. With that said, it definitely undermines the response, and it's very disappointing. I think we have to hold our leaders accountable. We are all part of the solution, and we are all part of the problem. If we elect officials, and it doesn't matter which side you're on, I'm not really worried about the political side you're on, but I want you to make sure you have leadership that believes in science and understands what makes sense. Mask and politics shouldn't really mix. mask and the economy shouldn't really mix. The point is, if we can't get our this COVID situation together, we will go back to doing the same thing. So we will actually be dealing with COVID until 2022, or maybe even further. So the piecemeal response has been the ridiculous response. We've learned that from what we did last year. And I hope that Mississippi and other states that want to come on and say the same thing will take caution to the wind. And by the way, the facts are that the number of cases of coronavirus right now are staying at they started a plateau, 60 to 70,000 per day. So that usually typically is the tipping point to say, hold up, it's not dropping. That means 4 to 6 weeks, maybe even 8 weeks later, it will actually start to rise. We saw that again in the last year, and UK is experiencing it right now. So the facts are in our face. It is ridiculous. That's how I feel about it.
Tell us how you really feel. I want to ask you, Dan, and also Maria Theresa, about something you talked, Dan, a few minutes ago about trusted messengers. And we have a question here about how do we get greater uniformity or stronger views within the medical community itself. I think, Maria Theresa, you were talking about, even you were talking about, I think, your mother, but there are so many nurses, so many doctors that themselves have been reluctant, reticent. They're in some ways, the most trusted messengers because they're inside the system. Are there efforts to try to have that conversation, as it were, within the house, within the medical community, to say, we have a responsibility not only for ourselves, but for our community to be taking these issues on?
Well, I definitely know we've had these conversations within our group. And it seems like, I would say 2 out of 3 were willing to take the vaccine. This was late last year when we started the rollout of the vaccines for healthcare workers. Even in the emergency department and in the ICUs, the discussion was, and it seemed like some of our nursing colleagues were a little bit more resistant than physicians. They're ambivalent, some because they were looking forward to procreating later on and they weren't as sure, and there was misinformation around that. So I think they've come around. A good number have been vaccinated, actually a significant number. And by the way, this was voluntary, or at least it was caveated as being voluntary. We highly recommend was the word that was used. And then there's some people who did decline. But yes, we've educated the population, and sometimes it is the knowledge base, understanding what a vaccine is, how it works, what are the similarities, how long have we been using it. And fortunately, in some of the circles which I've been in, because I've been in the biodefense space and I know how we've been planning for these and preparing for disasters and pandemics over the past 15, 20 years, I was able to pull back the veil and say, hey, this is a 30,000 foot view level, and here's the 5,000 foot level, so where it meets the end user, and be able to talk about how we've been actually using this for in terms of a cure for cancer and treatment and those types of things. So this is not really new, and explaining how the government works in terms of they were concerned, and lots of the concerns were regarding pregnancy and were actually regarding how fast it was. I said, we didn't cut corners. This is why we did this. We did this in parallel. We put a lot of funding and money and cut all the red tape, and this is how we were able to push this out in a timely manner. And I think they got that message, and those are the things we need to tell that story.
Great. Maria Theresa, do you have anything to add on that? I think you're muted.
11 months in, you'd think I'd figure that out. So the White House announced the Equity COVID Task Force, and it's headed up by Michelle Nunez-Smith. She is a physician, and they are going to be doing a lot of local touring, so to speak, trying to encourage people, especially the most underserved, the importance of it. This is new. Normally, these kind of task force, especially when it comes to health related, is everybody is seen as equal. They are recognizing that there is real hesitation among communities of color. Part of it is the disinformation. Part of it, to speak frankly, is the history of experimentation that the government has done on the bodies of people of color. So this is what they are very aware of it. And so I will share with you, we had a conversation on immigration. I had this conversation with them on the COVID task force about 3 weeks before. This is absolutely top of mind for them.
Great. Paul, I want to bring you back in, and there have been a couple of questions about, we're talking about a lot going on social media, and the Facebook, YouTube, Twitter, they control the venue. They're the platforms. Give us some of your thoughts on, what have they done? What should they be doing? How do we get this beast under control and have a more normal conversation based on facts?
Yeah. Well, I guess it's best to start with sort of the good news, what they have done. They've taken modest steps to try to address the problem related to the pandemic. Twitter, just a few days ago, announced that it would label tweets with potentially misleading information about COVID-19 vaccinations and introduce a new system whereby accounts or individuals that repeatedly spread misinformation would accumulate strikes toward an ultimate possibility of being removed from Twitter altogether. Facebook announced a crackdown on COVID-19 vaccination misinformation in February. YouTube made, generally speaking, a similar announcement last fall. The problem is that these efforts, while I think they're laudable and they show that awareness has grown within these companies that they bear responsibility for what's on their platforms, have proven to be insufficient. Otherwise, if they were sufficient, we probably wouldn't be here today. And I think the main thing that needs to be done is to invigorate the content moderation that's done, which is the process of taking bad material down, and improve the algorithms that basically sort through, rank, and recommend content to users. Those algorithms, generally speaking, are designed to maximize engagement, keeping people on the site with material that is often sensationalistic and certainly not necessarily accurate. So I think all the platforms are going to have to revisit some very fundamental aspects of the design of those algorithms such that they favor more authoritative information on important issues like public health, and disfavor, which is to say, don't recommend, don't rank highly information that is questionable. Clearly, users of these platforms, you don't see all the information that's on there. There's billions and billions of pieces of content that are being posted over the course of a week or a month. You only see a small fraction of that, and the companies have to redesign their systems so that less of that material is likely to be the kind of sensationalistic and often factually misleading on topics like public health, or for that matter, voting and elections.
Well, there's a question here about censorship, and the questioner says, who gets to determine what disinformation or misinformation is, and what's the criteria with these algorithms you're talking about? How do we prevent, censorship and abridgment of the First Amendment? Okay,
well, that's an important and broad question that has several elements to it. I guess I'd begin with the fact that while the question of free expression is intertwined with the operation of these platforms, the companies that own the platforms are not restricted by the First Amendment. They have, it's fully within their right, and I would say their obligation, to police their venues vigorously. The First Amendment refers to government. In our system, that's the federal government, state governments, local governments. All of those levels of government cannot, generally speaking, abridge free speech. But that simply does not apply to a company in the private sector. So that's step number one. Step number two is that I think while it is absolutely fine and even laudable that executives like Mark Zuckerberg talk a lot about wanting to favor voice and to foster free speech. That's all terrific. That's a big element of our civic tradition, that people have the ability to express themselves. But that doesn't apply to content or speech that leads to dangerous or even potentially deadly outcomes. So there actually isn't a free speech right to go on Facebook and say that vaccines for the coronavirus are going to, kill you, or they're going to have a chip, a microchip in them that will allow the government to surveil you, or that George Soros is going to profit from it. No one has a right to say that on Facebook, and Facebook does not have an obligation to amplify it. And if a particular individual thinks that Facebook is being too aggressive in weeding out dangerous material, that person has the ability to go to a different venue and to express themselves and to find information that they would find interesting or useful to them. So I think there has to be a mindset change that whereby people understand that the requirement or obligation of these companies to make their sites safe, to prevent imminent harm to individuals, actually prevails over the general aspiration to foster free expression, which, as I say, is a fine aspiration most of the time.
Just one more follow-up question to that. We've now seen over the last 4 or 5 years, you've written lots of reports, lots of people are talking about the lack of responsibility on the part of Facebook or YouTube to step up and do the kinds of things you're talking about. Do you think this is a moment for the government to step in and do more? And if so, what's the role the government should play in, again, moderating or regulating these sites to make sure that we avoid this harmful content?
Yeah. The short answer is yes. I think that the era during which the commercial internet, and particularly social media, has gone unregulated ought to be drawing to a close. We've seen that there are enough deleterious side effects from social media platforms that we need, really for the first time, to introduce some forms of government regulation. So, and now a couple of qualifications. One, some of this is already going on. There are, for example, significant antitrust lawsuits pending against Facebook and Google. That's one form of regulation. Maybe the companies are too big and too overbearing in their actions toward competitors and toward users. On the issue of how the platforms operate, I think we need to move toward some type of regulation which does not have the government influencing content directly. The government, in contrast to Facebook, cannot pick and choose among different types of content and say this is allowed and that's not allowed. Then you will run into First Amendment problems. But instead, to perhaps set up a set of standards whereby the platforms would have to disclose how their algorithms work to a greater degree so that outsiders could question them, outsiders who have expertise that I don't have, and understand better how the algorithms work, so that the companies could explain why certain people get this type of content and other people get a different kind of content. And there would be a whole slew of other things that would contribute to transparency and greater accountability that could be done by legislation. An agency such as the Federal Trade Commission could be given new authority to enforce these new standards. And we could begin moving slowly, carefully, but with firmness toward a situation where we had a better understanding of how these companies, which right now are really black boxes to us, how they operate and how they could be run better.
Great, thank you. Well, we're generating a lot of questions, which is a great thing, and I want to try to get a couple of them in. There are a few questions along the same lines about the role of the government in providing accurate information. And one questioner says, you know, the CDC, Center for Disease Control, has lost some credibility in the last few years. Somebody else says, which is the federal agency that ought to be leading in getting out this accurate information? I think other people, and Dan, I think you spoke to this a little bit earlier, are questioning, whether they trust the government at all. This goes to the political kinds of things, Maria Theresa, you were talking about. We're in such a polarized time right now, and people have different sets of facts. They don't trust certain sources of information. I want you both to sort of speak a little bit about where and how can the government play an affirmative role here as a trusted voice? Which agencies, is it at a federal, is it a local level? How do we regain trust in our basic institutions? This is a public health crisis. Lives are at stake. And yet people are tuning out official proclamations. I heard the head of the CDC yesterday say, please stay home, stop going to big parties. And yet it seems not to be registering as it should. How do we begin to change that? And where should we be looking to the government for leadership?
So Michael, I would just take a stab at it and say that sometimes the best leader is to know when not to lead. And in this case, while there is a low trust in government, there is a high trust in business. There's a high trust in entertainment. There's a high trust in local levels. And so I would encourage them partnering with the Walmarts of the world and the Targets of the world, where they can become mass distribution centers. And the less fingerprints there is that is a government intervention, in this case would be I would think a strong public health. Mm-hmm. The way we did a lot of our work at Voto Latino is that we would identify a Selena Gomez and then bring her in with an expert. And that was, she had 62 million followers. They weren't listening from Selena Gomez about the importance of the election. They heard some of that messaging, but then they heard from an expert of why their life changed, why it mattered. And so for the government, I know that they're doing all the best that they can, but there is a damaged brand right now. And if you look at it from that perspective, is like knowing when not to lead and who could be your allies. This is going to be solved by a civil society. And I would encourage them to partner with the corporations in many ways, as distribution centers, as people, as advocates, as local leadership. It's not, for example, it's not just communities of color. They're very reticent. And someone on the questions mentioned it and reminded me, older Republicans are reticent, right? We need everybody healthy. I always say the COVID does not know party or affiliation. And so it's, who are those messengers? I would actually reach out to the evangelical community and tell them to bring it together. But again, in this moment, it'd be like when to know not to lead, and who are the allies that you need to basically be your messenger.
Great. Dan? You're on mute as well.
We talked about not doing it. Yeah, thanks. So there are a couple of things. One, I do think, and I know that the CDC actually wrote the book on messaging when it comes to public health emergencies. I agree with my colleague that the brand is damaged. The brand has to be rebuilt. So one of the first steps is even the government has violated the trust of people of different communities, the whole BIPOC population. So let's call that out. So first, you have to acknowledge your wrongdoing. Second part, then you have to build that relationship. So those are the first things I think they have to lead with. Find those trusted messengers. I'll give some examples even on Clubhouse when I even partner with some celebrities, for example, Lupe Fiasco. Great voice in the community. He understands vaccines. And we partner together, and there's a mass number of people that come and listen and actually send us multiple DMs. Oh, because of you and this discussion, we are taking the vaccine, or we had this dialogue with our doctor, or I was able to convince my mom, or she was listening on a conversation. So it's going to be grassroots. So it's not just always top down. In this case, it's going to be from the groundswell, but they need the assistance or the guardrails of the federal government to be able to help those things move along. So I'll give an example. New Orleans, they have the vaccine for NOLA. Why? So they talk about their why they're getting the vaccine, and they spent only $1,500 for their mini ad campaign. Groundswell community work at the local level, literally. They got a bunch of people together and they explained their whys, different people, different stories. Why I'm getting my vaccine for NOLA. That's just a case, just another case. So there are multiple stories like these in different cities. but they need the support of their local governments, and the federal government needs to push funding in that way to support them and that messaging. And I totally agree. You have to partner with those messengers, but make sure that they understand the message so they're able to push that message out. But we have to acknowledge all the wrongdoings and not sweep it under the rug and call it what it is. And then for the political piece, just one of the optics that's not even out there. Did you know that President Trump and his wife actually received the vaccine in January? A lot of people didn't know that. They really didn't know that, but it wasn't in the media, and that became an issue for other people saying that, well, they didn't get it, and it became political. These are the things we have to really dissect and be able to put that information out there also accurately so people all know what's going on and then can make better decisions so they're not just following politicians, but also following the science mostly. Thank you.
Just following up on your last answer, there's a question about popular culture, grassroots, public outreach, and asking if it were better coordinated, would we have a better chance of beating the misinformation, disinformation on social media?
Yes. So Voto Latino, a couple of years ago, we co-founded National Voter Registration Day, Imagine Earth Day. And the idea was to get everybody who's not doing this all the time to do it with us. And the first time out of the bat, we ended up registering close to 300,000 voters. Fast forward to this past one, 6 years later, we had over 2,000 companies and we registered closer to 3 million, right? So imagine if we can put all of our networks together and actually do a day of awareness and combating the untruths and talking about and showing people, as the doctor mentioned, getting the vaccine, feeling that's good. We know from our work internally that peer-to-peer works, but peer pressure for good also works. People don't want to be left out. And so maybe we could have this conversation. I hadn't thought about it before, but maybe doing a day of action around this where everything gets flooded because that's all people are hearing. It becomes a free 360 and it becomes less scary with open forums and everything. That could be something that could be very impactful instead of what I'm witnessing right now is more of a trickle effect happening at different parts and disparities, but instead getting everybody to basically do maybe a week of action or one day of action, that could be incredibly powerful. That was a great question.
Yeah, it is a great question. I'm conscious of our time and I want to give you each a chance to say just a few words at the end. It strikes me this is such a critical moment. We've had a year of suffering and so many people died, so many people gotten sick. We now see the path to a more normal return, but we've got to hold our nerve. Mm-hmm. And this discussion of disinformation online is such an important piece of that. So I just want to commend you all for what you're doing. It's so, so important, but also to give you a chance to say just a few last thoughts about, are there things we've missed that we haven't talked about? There've been some questions, for example, we have a history. We have people who get vaccines for polio and we all sort of accepted that, or for mumps and, measles and rubella. We all know in our lives that worked. And yet we're fighting this disinformation about a disease that's so deadly. And it's sort of mind-boggling to me that we're in the place now where half of the Latinx community is still saying, I'm not sure I'm going to get the vaccine. Mm-hmm. So I appreciate what you're doing. I'd love to get your last comments before we sign off. This has been a great conversation. Dan, do you want to start?
Yeah, sure. Thank you all for having me. I think one of the most important things that I think we have to get that trust. We have to acknowledge our wrong deeds in the past. We have to show people how we're making it right now and how we will continue to make things right. I think that's important. I think we also need to be able to have open conversations where people can ask questions. And that's the beauty of what work we've been able to accomplish on Clubhouse with many of my colleagues, because it's an open forum, a dialogue back and forth. And they get to ask multiple layered questions and we get to respond real time. So that's been helpful. And then that spills on to other social media outlets, i.e. the Facebooks, the Instagram, the WhatsApp, and other outlets. So that's been Twitter. So that's been helpful. I think it's also important for us to now draw the line in the sand and say, we see the light at the end of the tunnel. What are we doing? Are we going to be an individualistic society, or we're going to be a community society? And if we are going to have two factions, let's accept it and then figure out how we can fix that. or how we can actually get along in terms of getting things done. Especially in this whole concept of insurrection and all these all tie in, by the way, climate change, everything. This is all related. Voter registration, all to what Theresa also mentioned. So they're all a continuum. So we have to really figure out what our society wants to be and what we want to do. And we have to hold our leaderships accountable. Every time voting does matter, it makes a big difference. So vote your conscience and make sure you're involved in that whole process too. Yeah, so those would be some of the big things that I would take home, and hopefully we can get to the other side of this and be in a better society. Thank you.
I'm going to want to bring Donna back in at the end, but quick thoughts from Maria Theresa and Paul.
So yes, I think one is, how do we combat this disinformation? I was just looking on my phone because Chris Hayes today with NBC brought out some really interesting pieces. When we talk about mask wearing, what does it do, and everything being equal. During this time between 2019 and 2020, we had 174,000 cases of flu. Between 2020 and 2021, present day, it's less than 1,500 cases. So this idea of mask wearing, of social distancing, of washing your hands, hopefully it's a cultural change, but it also speaks to, it does prevent the spread, not just of the flu, but the COVID crisis. So that's one. The other is when going back to my point, about 2-3 years ago, NPR did a piece where there was a huge anti-vaxxer movement in France and in the United States that was flooding the internet. They did digging, and after a couple of layers, they learned that it was Russia that was behind the anti-vaxxer movement with a lot of the spread of this disinformation. This is a type of cultural warfare, so to speak. And I'm elevating it because it goes back to my point. The reason people don't want us to get vaccinated is that they don't want us to trust our government. They don't want us to trust our institutions. It is a way of either radicalization at the worst or voter suppression at its best. And we have to be attuned, because if we are not healthy, if we are not thriving, there are foreign actors that will take advantage of this. And I'm not trying to be conspiratorial, but just very clear-eyed of what the stakes are. And so the more that we could be having these conversations that are peer-to-peer, being involved in telling people the right information and trying to see beyond the bend, that's how we can inoculate ourselves. And I have to share with you, thank you so much, Dr. Fubuji, for all the work that you're doing. I think that terminology matters. The fact that they identify you as a frontline worker is incredibly unfair and burdensome. You are the last line of defense. And so it's our job to make sure that we are keeping you as safe as possible and your colleagues as safe as possible. Folks, wash up, wear masks, social distance, even if you have the vaccine.
Great. Well, I'm going to give you the last one.
Yeah, I think I'm hopeful that we're entering a new era where we recover an understanding of the difference between fact and untruth. Which I think is at the core of the disinformation problem, and both private companies and the government ought to be able to help lead us back to that distinction.
Great, thank you. Thank you all panelists. Donna, last word from you.
Oh, wow. Okay, well, thank you, Dan and Paul, Maria Theresa, for this really informative and actionable discussion today. This could have gone on for a lot longer. And Mike, thank you very, very much for organizing this panel and bringing us all together. And a very timely, topical, I want to give a shout out to the health worker activists who today just launched the organization, The Conversation Between Us, About Us, is a new campaign to provide Black communities with credible information about the COVID-19 vaccines, which is a forum where Black doctors and nurses and researchers can dispel misinformation and provide facts. So, there is a lot of incredible activism going on around this topic. I was really struck that, Dan, you likened fighting disinformation to your time in the military, which I think signals what I've been hearing from you all today, that we need an all-out response. And I want to thank the leaders we had with us today and so many others for the commitment in combating this. Maria Theresa mentioned many other organizations and people doing this work. I think it's also worth noting that for many, including health workers and public health workers, that they do this at great risk, including harassment and even death threats. And we really can't forget that. And so elevating these voices and providing science-based information has become a major part of PHR's work over the last year. And one way that participants today who are listening in can elevate these voices is just to share the recording of this discussion, which will be shared shortly on social media and also on PHR's website. So share it with people who can elevate it as well. And lastly, I just want to say, I hope you'll join us for future conversations. We have some incredible webinars coming up on March 25th. We'll be talking about the exacerbating impacts of structural racism on public health. On Thursday, April 1st, what we can learn from the HIV and AIDS pandemic as we respond to the COVID pandemic. So stay with us. Thank you all very, very much for today. It was really terrific and we're so grateful. Stay safe, everyone.
Thank you.